In recent years, there has been an accelerated use of digital innovations to improve the quality of perinatal care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. Technology has become a critical aspect of healthcare delivery. Digital solutions have provided avenues for improved access to OBGYNs, doulas, lactation consultants, specialists, and more. Apps for remote patient monitoring or chat and text-based navigation services offer additional ways to support and coordinate care. Joining Priya Bathija, Vice President of AHA Strategic Initiatives, is Mary Lussier, Lactation Services Consultant at Connecticut Children's. Mary shares how the use of Keriton, a feeding management, lactation analytics, and patient engagement platform, has improved perinatal outcomes. This podcast is part of AHA's 7 and 7 series.
Thank you, Tom. Mary, thank you for speaking with me today. Can you share a little bit about how Connecticut Children's is utilizing Keriton's Care Mom app to improve perinatal care and share a little bit about how the app works for patients and providers?
Sure. Thank you for having me, and I'd be happy to. So the Keriton platform actually has several apps. Care Tech app that works for our milk technicians, Care Nurse app for our nurses and lactation consultants, and then, of course, the Care Mom app for the moms. So it's actually a platform of several apps that work together to create an entire feeding safety management system. So I would say in terms of improving perinatal care, there are probably two big buckets. One would be feeding safety for sure, and the other would be patient engagement. So to understand how it works, we need to talk a bit about the electronic medical record because there is a bidirectional flow with the EMR. So for example, during preparation process, when our milk technicians are preparing the milk, we have the electronic medical record where the most recent feeding order has been placed. That feeding order flows into Keriton. So if the milk technician is preparing a feeding and they do anything that goes outside of what that order is, Keriton will give them an alert and they will not be able to proceed. The same thing happens with actual feeding. At the time of feeding, when we're feeding a patient, we scan the wristband, we scan the label on the syringe or the bottle, and if that doesn't match the most recent feeding order for that patient, or if the milk is expired, or if it happened to be the wrong mother's milk, the nurse would receive an alert, and we would know that we could not proceed with that feeding. So there's just many facets of this that improve patient safety as it applies to feeding immensely. And then the other would be patient engagement. The mothers scan the labels that we provide for them, and they input that information about their pumpings into the app. And what it does is it actually creates a database of information that both the families can see and we can see in chart form and also in graph form. And we can see their progress pump to pump, day to day, week to week. So it's a huge patient and family engagement advantage to be able to sit with them and look at this information.
Yeah, and it sounds really great that you can sort of track how much, the baby is being fed in a way that, you wouldn't be able to do without this app. And can you share some of the outcomes and successes that you've had by using it?
Sure. So one thing I really want to mention is how much this has helped us during the COVID pandemic because we've had very strict visiting guidelines. So the app has a texting feature within it where we can text the moms through the app. We can see how they're doing with their pumping sessions. We can text them and ask them questions. They can text us and ask us questions. And we also send them pictures of their baby through the app. And the ability to stay connected to these mothers throughout the pandemic has just been amazing. We've also had the ability to catch problems early because of both the database I mentioned and this ability to communicate with families through the text because they can text us questions about pain or inflammation or other symptoms they're having that we can respond and catch very quickly before they get something, for example, like full-blown mastitis. And then, of course, back to the patient and feeding safety, we've caught near misses with this platform, times that we've almost fed expired milk, almost fed milk feedings that didn't match the feeding order. We've caught them because the app tells us when we catch it, and we go back and review those every month.
That's really great to hear. You mentioned texting as being sort of the way that you are reaching out to patients. Are there other ways that you are ensuring digital health equity for your patient population?
Sure. So I will say that you don't have to have a phone for us to be using Keriton for patient. So we have yet to have a mom who doesn't have a phone, believe it or not, but that's the truth. But of course, at some point we probably will, and in that situation we would provide her with the labels for her breast milk, and she would just write the date and time she pumped, and we would handle the rest of the pieces of that when she brought that milk in. I would say I've seen actually the greatest benefit to our moms who are in our lower socioeconomic status, because they often have the hardest time getting into the hospital frequently because they have transportation issues, have other children at home that they can't afford to pay a babysitter. So oftentimes they are here less often, but we've been able to stay connected with them through Keriton, which has really improved our communication and made a huge difference, I think, for them feeling connected to us and to their baby. So that's been such a positive for us. Also, the app is in Spanish and Portuguese. And again, if you don't have a phone, you don't lose any of the safety features because all of the application features are still in play, even if the mom is just handing us bottles that she writes on. So I think that's really important, so we don't ever have to feel like if a mom doesn't have a phone that, she's not having the same safety with feedings as other patients. That's not the case at all.
Mary, that's really important, and I'm grateful that you have put so much thought into making sure that all patients can access this solution and can have the benefits of this feeding safety for their newborns. Thank you again for sharing these outcomes that your patient population has experienced after integrating Keriton's Care app for your patients. And to our listeners, thank you for joining in. You can listen to more podcasts in the 7 and 7 series at www.aha.org/7in7. Thank you and have a great day.